Namaste. Welcome back to the session of Parijaraka class regarding quadrants of healing. On the part 1, we discussed about the quadrants of healing and in detail about in the two quadrants, the Bishak and Dravya. So today we will discuss in detail more. Before starting, let us do a prayer. Om Namami Dhannantari Madidevam Surasurer Padapatmam Loke Jararupphaya Mrityunasham Dataramisham Vividhaushadinam. Okay. So what we studied in the last session about the quadrants of healing. Let us rewind the shloka or the verse regarding the quadrants of healing. Bhishak dravyani upasthada rogi pada chadushtayam chigilsidasya nirdishtam pratyegam tat chaturgunam dakshasthirthat shastrartho drishtakarma shujir bishak Bahukalpam Bahugunam Sampannam Yogyam Aushadam Anurakta Shujir Daksho Buddhiman Parijarakaha Athyo Rogi Bishakvashyo Jnapakaha Sattvavanapi. Once again, Bishak Dravya Nupasthada Rogi Pada Chadushtayam Chigilsidasya Nirdishtam Pratyegam Tat Chaturgunam Dakshasthirthartha Shastrartho Drishtakarma Shujir Bishak Bahukalpam Bahugunam Sampannam Yogyam Aushadam Anurakta Shujir Daksha Buddhiman Parijarakaha Adhyo Rogi Bishakvashyo Jnapakaha Sattvavanapi. So we discussed about Bishak and Dravya. Today we will see in detail about the Parijaraka and Rogi. Who is Parijaraka? The therapist or the supporter, the caregiver. We can say like that. So that is Anuraktaha Shujir Daksha Buddhiman Parijaraka. It is told like that. So this is very important. You should know in detail about your role. What is your role in a treatment, or in the success of a treatment, or the healing journey of a patient. What is your significant role? That each and every therapist should be aware about that. Like this is not just a mechanical thing. You should involve by yourself into that journey of healing. So how you can do that? You first of all, that kind of a immense feeling or that kind of an empathy should come from your mind, or maybe as inborn it can happen like that, or maybe as a passion in this profession you can get that feeling. For just sake of a job, it may not be working like that. That kind of immense pleasure you should feel after treating each patient. Then only you can understand that. So that is expecting from or by the acharya who wrote all those things. Like that kind of a quality person only can be the best therapist or the best Parijaraka. So like in the day-to-day management of a patient, more than a physician, a therapist will be attending the patient very regularly. Many times in a day, they will be giving medicine, they will be doing the treatment, and they will be serving the food or whatever it is. All these things will be, or it will be good if the therapist or the caregiver is giving. So like the patient will be totally connected with the therapist. So their energy can do a lot of changes, can make a lot of changes in the body and the mind of the therapist, of the patient actually. So that much of a strength or that much of a power should be there in the therapist. Like the energy should be maintained like that, which is very important also. So that's why Acharya told this qualities like this: Anuraktaha, Shujihi, Daksha, Buddhiman, Parijaragaha. Anurakta means it's very like the person should have by birth interest in the patient's welfare, or like that very intense interest should be there in the patient's welfare, and he should be having enough purity in all levels. That the Shuji doesn't mean only the cleanliness, and internal purity should be there. And Daksha means, we can say, the alertness or the efficiency of the therapist. And Buddhiman means well trained, like well experienced. So these are the primary qualities we can say for a therapist. How it is important, or how it will be helpful in the healing. Are you able to connect that, or just it's a sake of study? Do you feel like that? Try to connect, like when you experienced any small illness or any short duration hospital admission, stay in the hospital. So that time, how you connected to the system? Mostly everything through the nurses or the caregivers, right? So your primary needs, everything you'll be communicating with them. So how much they are connected to you? That is in the modern system is also like that. The nurse or the helper, or like who is taking care of the patient, will be in like it's not much easier, like it's having some limitations, we can say. But in Ayurveda therapist, it is not like that. You will be doing the therapy for the patient, the external therapies that you will be going to do. So the patient will be like a baby in front of you while you are doing the treatment in the treatment room. They may experienced a whole body oil massage in their childhood by their mother or grandmother, and helping for a bath maybe in their very very younger age with like this mother, father, or someone very nearest one. So after that, even they're not getting any regular therapy and all. They may be you may be like, for them they may be remembering their that much childhood memories while in touch with you, like whenever you are giving treatment for them. So you are going to touch the deeper or the inner part of the patient, not only the external body. So they will be connected to you like that. So it's your responsibility to be to maintain that rapport with the patient, and it will be like for their complete healing, how much support you can give. That's your responsibility, because they will be that much that much connected to you. So like that, a prepared mind should be there for you before starting, or whenever you are entering to the experiences. You should keep this in mind. This is you are going to connected with the patient in very deeply. Okay, so that is the anurakta, like that much interest in the welfare of the patient. Like you should do that. You should take it as a challenge. Like I'm going to help him to recover, or help her to recover from her illness or whatever it is. So that kind of a attitude you should develop, like best attitude you should develop towards your profession. It's not just like a mechanical thing, it's really lively, and your energy need to be kept at the maximum, to the optimized stage for your healing and also for the patient healing. And this shuchi or cleanliness, that is also so important. Like you may be aware, like you are going to do all the things for the patient, like you are going to apply the medicine on their body, and you are doing the massage with your bare hand on the body of the patient, and you will be doing whatever the medicated water or the oil, whatever the things you are going to apply on the body, or even with totally direct hand or bare hand or with something, whatever it is, your body is touching the body of the patient continuously for on a daily basis. So it is very important to keep self cleanliness, or your own hygiene. You should maintain your own hygiene. Like from you, the patient should not suffer. At the same time, you are not supposed to get suffered from the patient. Like any kind of infections may be there for the patient, but it should not spread to you. So you should take care of you and of the patient also. What you can do for that: maintain a very clean environment. The treatment room, the treatment table, or whatever the things around you are using should be clean, and that should be maintained. Whoever is changing, maybe in the hospitals, big hospitals, and the therapist may change in between, but whenever you are changing also, they should know properly what is going to do for the patient. So that kind of things you should follow very strictly. Then you can keep the external cleanliness. At the same time, as I mentioned before, the internal cleanliness is also so important. Your mind should have a clarity towards maintaining a clear inner space for understanding the patient, and for spreading the energy of healing. That will be helpful. So, and next is the quality called daksha, that we already discussed. This quality is told for whom one more quadrant is having the same quality. For whom it is for the physician. Dakshastirthartha shastrartho drishtakarma shujir bishak. It is told like that, no? At the same time, it is told here also, anurakta shujir daksho buddhiman parijaridaha. So daksha, that means the alertness of a physician, of the therapist, alertness or activeness or efficiency of the therapist. Like we don't know what is going to happen during the treatment time. How you can manage that? Like maybe sometimes some kind of accidents can happen during the treatment time, like a kind of burn or a kind of fire kind of things can happen, because you are going to treat the patient with some kind of heating therapies. If like that, you will be dealing with the fire, and also any small injuries or things can happen. But how you should manage that? You should have a emergency management training. You should attend that. And how in the emergency situation, how you want to respond, that you should be known. You should get a training for that, and that kind of discriminative thinking also should be there. In another one thing, during the Panchakarma and all, maybe some adverse effect can happen while during vomiting. That during Vamana therapy, the patient can get blood vomiting. So that time, whatever the doctor is advising at the moment, you need to prepare that from. Mostly the things will be kept with you to prevent this kind of any accident, and to prevent any kind of accidents. So that kind of a active decision we may need to take some time in between, which is very important. So you should keep your mind, or you should keep you ready to manage that also. And one another thing, if the patient got sick in between the therapy, fainting or something like that, how you are going to manage? You may actively participate in that, maybe spreading some water on the face, giving artificial breathing sometimes may be needed, and the patient may be in a naked form, so you may need to wrap him or her with some cloth. These kind of things should go in mind during that time. So that is this that kind of a thought process should be there. And the last quality is told buddhiman. Buddhiman means well trained, we can say, or well experienced. So whatever you are studying in the theory, that is just basics only. You should get proper knowledge from the practical or from the day-to-day experience with elder therapist or with many patients. Like that only you can develop by yourself. Okay, so that kind of intense training should happen, or you should attend that, and continuous training after one also. You need to be streamlined all the treatments, and you need to make your actions very quickly and very effectively also. For that, the trainings will help you a lot. So that kind of proper training is necessary. So it is told, the bystander or a paricharaka, such as a caregiver or family member, plays a crucial role in the patient's recovery. They must possess anurakta or compassion to provide emotional support, and cleanliness to maintain the hygiene in each level, and alertness and efficiency to assist with medical needs, and buddhiman, intelligence to understand and follow the doctor's instructions. A good caregiver ensures that the patient adheres to the prescribed treatment and recovers in the nurturing environment. So the therapist should be that much continue or develop that much observation power, which is also very important. Then only they can discuss with the physician and let them know how the things are progressing, kind of things. For that, a continuous deep observations are needed. So these all are the qualities of a paricharaka, we can say. And more than that, in the modern way, they are giving some more qualities of a therapist or nurse. That is the therapist or nurse should be caring and should have a good communication skill and empathy towards the patient and the situation, and should be very straightforward in the work, making decisions and giving good proper work at the proper time. And attention in that each stage of treatment, it should be there, how the patient is responding to the new medicine or new treatment or whatever it is, and all these things are very important to follow. And more than that, the very important thing is the stamina of the therapist. Therapist should do the treatments, and then also he or she is not supposed to get any health issues. That much stamina by proper exercise and by proper medicines or food or whatever it is, they should maintain. That is also very important. Your health is the most important thing. And another thing is their way of talk or communication skill or sense of humor, we can say. And that is very important. It's no need to maintain a very formal way of talking or formal way of managing the things. Always the healing can happen with this sense of love or affection or care. That kind of soft feelings will give a lot of result in the healing of a person. Like, no, I'm using the same word healing, not just a treatment or not just the management of disease. In the healing, this warmth of mind or warmth of the energy gives a lot of difference. So a good nurse or parijarika should have that also. And commitment to the patient, like whenever necessary, the therapist or even the physician should be available for the patient. So that kind of a commitment should be followed. And critical thinking is very important, as I mentioned before. Whenever any unexpected situations are coming, that time they should have enough like discriminative power to take a decision through a proper critical thinking. And time management, which is also very important, managing the time properly, like in the sometimes the treatment is told for a so and so time, like maybe for an hour or sometimes maybe for half an hour or 20 minutes. Whatever it is, that should be followed well, which is also very important. Like then only the patient feel they are giving their time for you, like in a disciplined way. So that is very important. And leadership quality, that should be there, like whenever many patients are coming together, that time you should give priority for the patients, and according to that you should lead each patient, which is also a very this kind of qualities can be improved by proper training, maybe for few years continuously. That is also necessary to do. So these are told for the qualities of a nurse. And so that is Anurakta, Shujir, Daksho, Buddhiman, Parijaragah. Anurakta, Shujir, Daksho, Buddhiman, Parijaragah. So like you should be interested in the patient welfare. Anurakta, Shuji, that in internal and external purity. And Buddhiman, well prepared or well trained or well experienced, we can say. And by Daksha, that the alertness or the efficiency of the therapist, these should be maintained. So this is very important to know this shlokas, what we discussed already. ഭിഷദ്രവ്യാണ്യുപസ്ഥാദ ആരോഗീപാദചതുഷ്ടയം ചികിത്സിതസ്യ നിർദ്ദിഷ്ടം പ്രത്യേകം തച്ചതുർഗുണം ദക്ഷതീർത്ഥാർത്ഥശാസ്ത്രാർത്ഥോ ദൃഷ്ടകർമാ ശുചിർഭിഷക് ബഹുകൽപം ബഹുഗുണം സമ്പന്നം യോഗ്യമൗഷധം അനുരക്ത ശുചിർദക്ഷോ ബുദ്ധിമാൻ പരിചാരക. Regarding the parijaraka, there is one another prayer is there, which is very important. Like that kind of a mindset you should develop before starting treating a patient. The shloka says like this: Om ayame hasto bhagavan, ayame bhagavantaraha, ayame vishwabheshajo, ayam shivabhimarshanaha. You may heard that, or you may study that, or you will study, of course, like in the main shlokas when you are studying this also. That means like this: Ayame hasto bhagavan, ayame bhagavantaraha, ayame vishwabheshajo, ayam shivabhimarshanaha. Ayam means like you, like that how it can expand means it is told like this: both my hands are divided. My therapist is chanting this shloka before doing each treatment, and he's telling like this: both my hands are divine, they can bring prosperity and they can give a soothing effect. Moreover, they are more powerful than being simple divine. All medicines for the disease of the world lie in my hands. Touch of my hands can capable of well-being and healing. So, like, I am a hasto Bhagavan, both my hands are divine. The divinity of healing is there in my hands. He is praying like this, and all they can give a soothing effect. By my hands can give a soothing effect, or more than that, I am considering as the medicine for all diseases or all kind of diseases in the world. Vishwabheshaja, I am a Vishwabheshajo, I am Shiva Bhimarshanaha. It is told at the end like this: touch of my hands is capable of well-being and healing. For your well-being, just touch of my hands may be enough. So this is the prayer given by her. This is the prayer can be continued for a therapy. At the first you can tell or you can chant this. This will gives a lot of energy for you and also for the patient. Once again I'll repeat it. Om Ayame Hasto Bhagavan. I am Bhagavantaraha, I am a Vishwabheshajo, I am Shiva Bhimarshanaha. So this is very important, like how a therapist is considered in our ancient system of knowledge. Like, it's a very powerful position they had given for you, because you are going to lead the patient in the right pathway. So these are the qualities of a therapist we discussed. Anurakta, Shujir, Daksho, Buddhiman, Parijaraka. So what is next? Next is about the Rogi. And I can add a few more points regarding the therapist, qualities of a therapist, like that is the knowledge, foundation of effective therapy, that is also maintained or it should be attained by the therapist. That means understanding Ayurveda, its tradition, principles and wisdom, and knowledge of the human body, anatomy, physiology and energy level system, and awareness of nutrition, food, herb, therapeutic recipes, and master of Ayurvedic therapies, like techniques, sequences and applications. All these things you can consider as a one of the quality of a physician, like a therapist. And the skill is considered as next: mastery in practice and application, like the skill of mindfulness, being present and attuned to the clients, the skill of preparation, setting intentions and readiness for therapy, and skill of communication, clear, compassionate and the therapeutic interaction, the skill of technique, precision in Ayurvedic methods, that treatments. So this kind of skill should be developed for a therapist. And another one is cleanliness. We discussed a lot of from that. The heart of hygiene and sacred space, like purity of intention, maintaining integrity and awareness in the practice, which is very important. The intention should be the healing of the patient, nothing else should be. So that kind of a purity of intention, maintaining integrity and awareness of practice. And another one is the hygiene and sanitization, maintaining a safe, sterile and healing environment, and clean communication, clarity, respect and honestly in client interactions, like that a clear communication without making confusions and making them comfortable. That communication should be helpful. And beauty, the art of creating healing and inspiring space, practice, aesthetic harmony in healing spaces, creating a calm and living atmosphere, and aesthetics in posture and body language, graceful and grounded and pleasure, and aesthetic in attire, dressing with comfort, professionalism and alignment, and even in the aesthetics in communication, speaking with warmth, empathy and clarity, and aesthetics in treatments like enhancing the client's experience with elegance and care. These are the beauty skills or beauty part should come from the patient side, which is also should be maintained well. So these are the qualities of a therapist, we can say. Okay, so what is that? Anurakta, Shujir, Daksho, Buddhiman, Parijarakaha. Okay. Next is about the qualities of Rogi or the patient. So the Rogi or the patient should be like, if the patient is ideal, we can expect a better result in the treatment. So the ideal qualities of a patient is describing here everything, like even the about the Bishak or the Dravya or this Paricharaka. The ideal qualities were discussed. In case of a patient, we can't expect the qualities will be ideal. Like the others, it should be like that. We can or we can improve the qualities from our side. But for a patient, it is not like that. Like we can't expect like these qualities in each and every patient. So what we need to do, like we need to accept that gap difference from these qualities, and then we have to mold it properly, and we should educate them about all these things, and without hurting them, and then they can improve by themselves. And whenever a patient is having like these qualities, then only it will be leading to a proper healing. So let's see what are the qualities. Adhyo Rogi, Pishakvashya, Nyapakaha, Sattvanapi. These are the 4 qualities told for a Rogi. So Adhya means able to go through the necessary therapies, like it can be in different ways. Like the patient should ready to follow all the restrictions or what are the advices given by the physician, like maybe because of some financial problems or because of some unacceptance for this changes. That kind of problems may create stress for the patient, and they may not get the right result in the right time, on the right time. So what we need to do, like we need to educate the patient what is going to happen, or in each step what we can expect. According to that, they can undergo the therapies. So like even their health is also should be like that. In case of this panchakarma kind of therapies, they should have a minimum health, then only they can undergo the therapies. So that is also their adhya character, we can understand from that. And Bishakvashya means who is obedient to the healing staff, maybe the physician or the therapist. So if the patient is obedient, or if the patient is ready to change that their things, whatever their routines or whatever the things, if they are ready to change according to the advice of the physician, then only we can get the benefit in the treatment. Otherwise, if we need to compromise for the patient in different stages of the treatment, it won't give the right result. Like sometimes very light food only we can advise for the patient during this some kind of specific treatments. But if the patient is not ready to go through that or not ready to receive that kind of food, what happens? We may need to something else. So it may not be suitable for them, like the Agni or the digestive system may not be working well for them. So that kind of unwanted issues can be created with that. So the patient, it will be for their betterment, it will be good to follow the advices or whatever given by the physician. That is also very important thing. And Nyavaga means what? Able to report accurately the changes in their body, what it is happening in each step, what it is happening. Like they should observe their internal changes, internal physiology, like their bowel movement, their respiration, their digestion, appetite, sleep, emotions, everything. Like they should observe that, and they should report to the patient and to the physician on time. Then only they can make the right decision about the treatment. So like that kind of a proper observation power that we should develop in the patient. Then the next one is about sattvans. Sattvan means having thorough knowledge about their health, disease, and healing. That sattva quality, or openness, we can say, and a clarity about the understanding of their health, or the disease, or the healing. That should be there. They should not follow blindly, but they should be clear about what is going to happen in their body. If we can educate the patient like that, and the patient is ready to receive that, then the treatment will be 100% successful. These all are the ideal situations, but we may not able to find such a patient always. But what we need to do, like we can understand the gap difference between these qualities and the characters of the patient. So according to that, we can mold ourselves, and we can mold the treatment also. So that is also very important, the practical aspect in the studying of these qualities will help us a lot like this. And it is not just for a theoretical purpose. It is not just studying this 4-line words and just writing for your next examination. That doesn't mean in this. This is very practically important topic when you are communicating with the patient, when you are managing an Panchakarma center or an Ayurvedic center, when you are working with different types of physicians and different types of patients, then you can come to know how to deal with them, how to manage their needs and the route of the treatment, how we can manage that. All those things are coming from this, like this kind of proper understanding about the qualities will make easy for that. So you should study the shloka, one thing, and you should know the meaning of each word, each qualities, and these all are for exam purpose. But for practicing as a successful therapist, you should know the theoretical part of or this ideal qualities of all these 4 quadrants, and then in your day-to-day life you can understand how it will be helpful for you, like to manage the situations or the patients like that. So let us repeat what we studied about the qualities. So what are the quadrants of healing? How many quadrants are there? 4 quadrants. What are they? Bishak, Dravyani, Upasthada, Rogi, Pada Chatushtayam. Chigilsidasya Nirdishtam Pratyegam Tat Chaturgunam. What are that 4 gunas? That all these 4 quadrants are having its own gunas, its own qualities. Each of the quadrant is having 4 gunas. Chaturgunam. Chatur means 4. 4 gunas or 4 qualities are mentioned for each of them. What are they? For the Bishak, Dakshas Tirthartha Shastrartho Drishtakarma Shuchir Bishak. So Bishak is Daksha, Tirthartha Shastrartha, Drishtakarma Shuchi. Okay, means we, as we told before, that is the Daksha means the alert or disciplined or we can say like that. And Shastra, Tirthartha Shastrata means having detailed knowledge about the disease and treatment. And Drishtakarma means practical experience, having a lot of practical experience. And Shuji means cleanliness. And what is next about the Dravya? Bahukalpam Bahugunam Sampannam Yogyam Aushadam. So what is Bahukalpa? Bahukalpa is ability to formulate in different forms like decoction, powder and all those things. Bahuguna having enormous qualities, a lot of qualities. So we can use that in the different kinds of diseases. And then Sampanna. Sampanna is what? Endowed with the multiple therapeutic effects. Action should be in the wide perspective. Okay, and Yogya with high quality herbs. The medicine should be prepared with high quality herbs, which like according to the place or according to the climate, the quality of the herb will be different. So one formulation will be having different kind of herbs. So that herbs, all the herbs, if having the higher degree of potential, the quality of yoga or the quality of that particular formulation is will be high. So if it is not like that, the combined effect of the medicine will be less. Like for example, we will be getting the good quality of some herbs, like for example, this Moringa oleifera, that is very famous nowadays, Moringa. So which is very common nowadays in the summer season. So it is having higher potential. Even sometimes in winter or in this rainy season also, it can see one or two leaves or one or two this one. What I have to say that fruit also, but it won't be having that much quality. In the summer it will be having more quality. Like that, each medicine or even vegetable also having some higher quality in that particular harvesting time or that with particular climate. So like that, the medicine should be collected and stored in there much whenever the quality is having at the maximum level. So that is mentioned here. If you are making a particular combination of medicine with all these kind of herbs, its benefit will be so higher. Okay. And what is next? The Paricharaka. Anurakta, Shujir, Daksho, Buddhiman Paricharaka. That we discussed in detail. So I think you are aware about that. The therapist should have the interest in the patient's welfare, and inner interest should be there, and purity in all levels, and alert and efficient or disciplined and well trained. So while checking these qualities, you are seeing two qualities of physician and paricharaka are almost same. So you understand this patient care means it's not just a very small or very short time duration, or not for a smaller interval, and it is long time, and many people or many members are involved in that. So for that, a well structured plan should be there. So that plan should be executed by the physician and the paricharaka or the therapist. So they are playing major role in that. So that is their responsibility to take care of the patient in such a way that so it will be good to have a proper understanding about all those things. And next is about the patient. So Dyogi, Vishakvashyo, Jnapakaha, Sattavanavi. So that we already discussed, the patient should be Ajna, that means able to go through the necessary therapies. Vishakvashya, obedient to the healing staff, either the physician or the Parijaraka and Jnapaka, able to report accurately, and Sattvavan, having thorough knowledge about their health, disease, healing, etc. Nowadays we are getting a lot of patients like this, like they get knowledge about their disease from the different social medias and the Google or whatever it is, and that makes them anxious, a lot of anxiety regarding the disease, how it will be working like that, on each stage what is going to happen like that, many confusions they may be having. But what happens, that confusion or anxiety won't give any result for them. So what to do? The understanding of disease doesn't mean it should be clear, like the understanding of the proper way it should be taken by the patient, not to increase their anxiety. If the patient is having such a mental capacity, then only it will be worthful. Otherwise it will increase their stress and anxiety, and it may leads to some psychosomatic conditions also. So what we can do, if it is like that, their anxiety level is more, try to make them educate, or try to educate them in the proper way. Like for that the physicians will be doing that majorly, but you can also support to that. That is very important. The stress and anxiety always leads to many kind of issues, so that is very important. We should take care of them in that perspective also, like that we should clear, like the Jnapaka quality of a patient is like they should able to process that the disease in that proper way. Otherwise it will make issues for them, like they may not knowing the right medical language, and they are reading about whatever is getting in front of their eyes in their laptop or mobile, and they may be getting confused about that situation increases the symptom, and the confusion makes them very hard, like to take a decision kind of things. So we need to give the right knowledge about the disease to the patient, which is also very important. So these are the 4 qualities of the 4 quadrants of healing. So you should be thorough about that. This is very important question in your exams also, and it is practically also very important topic. And some other points I just want to discuss with you, the qualities mentioned here. I have some experience with my patients like that. I think that will help you to practicalize these qualities. Like one of my patient, actually she's also from a modern medical system. She was when a few months back she was here, and she was taking treatment here. That time she was happy at the end of the treatment and all, but during the treatment time she is so keenly she observed everything. So whenever the patient undergoing some oil massage or something, the treatment, she just touched the back side of the treatment table, not on the table surface and all. Just she touched her hand that side accidentally or somewhere like that. She got some powder from there. So she suspected that powder was from the last treatment done by the therapist before her turn. Some other patient was there in the treatment room, and that is the residue of the last treatment. She got nervous about that, and she was so anxious. She was like a very difficult time for her and for that. But whenever we inquired, it was by mistake. It happened on the other side of the treatment table. It was not the residue of the treatment and all, but somehow she got some powder from that. So that is the importance of like keeping the area clean, very clean. Like the patients will be so anxious about that, because you can understand, because the the treatments will be doing in without clothes on them, and they will be using the treatment table. Here we are using the wooden table, so which is very useful and very effective, but sometimes the wood itself having some powder and it can be come out. So but like this kind of things can happen. So you should be that much careful to maintain the cleanliness in each stage of the patient care, not only in during the treatment. Whenever you are giving medicine to the patient, just the glass, the spoon, whatever it is, it should be 100% clean, which is very important. Like, it is not to show to the patient only. This is very important in patient care. Like, their body will be so sensitive during the treatment time, because we are subjecting them to different kind of treatments, so the body will be so sensitive. That means their immune system will be so responsive. So any mild change in their routine or things can make trigger in their immune system. They may get any allergy or infections or just flu, cold kind of things very easily. So we should take care of them as a baby, as a newborn baby, that their body will be so sensitive like a baby. So that's our responsibility. So whenever we have a small baby at home, we will keep everything neat and clean always, no? And whenever we are using the natural things only, it is a little more effort is needed for that, if we are not using any chemicals for this cleaning kind of things. Here we are running like that in baby grammar, so an extra effort we need to keep always, but it is successful. It is 100% successful itself. So yeah, that is the one of the quality of even physician and therapist. It is told as the shuchi, or the cleanliness. So this is very important for that. And one another patient, like I just remember her now. Like, these all are the the quality of a therapist. I would like to give you idea about that in detail. Like, what happened means that lady was very bold and strong lady. She was not had a lot of issues and all, but some pain, all those things, problems. That time we advised her local some like some Portalis Vedana in the special some area, like in the shoulder. I think she had some shoulder pain or something. So that in that area only we advised for this this Portalis Veda with some powder, some medicated powder. What happened means she couldn't feel the heat of that Portly at the starting, because her body needs more heat. So she demanded for that. She needs more heat. Always the therapist should check the heat of that potli before touching to the body of the patient. They will check by their own body first. Then they will be doing that. And whenever the therapist is checking, she is getting good temperature. But when she is doing for the patient, she is not. The patient is not getting satisfied. She told to increase the heat again and again. At last the therapist did that. First she refused, but she did that because of the pressure. But what happened, next day her shoulder got burnt, like inflammation came on that area. And then also that's a demand came. The patient demanded for more heat, but the therapist is not supposed to do like that. Even the patient demanded also, they should hear from the doctor also it is need to be done or not, or they can check with the therapist at the same the doctor at the same time, and then can take a decision, or they can plan it for next day, kind of things. Like this, a critical analysis of the situation should be done by the therapist, and the decision should make like that. It is also very important. Sometimes it may not be done like that. So it it sometimes creates like these issues. Even the patient demanded also, they don't know how it will be affecting for them, so you should educate them. If you are increasing the heat, there is a chance of getting burned for you. That may not be able to understand now. We can understand that for next day only, because it's not that much sharp heat. So that kind of things we should explain and give, like loyally we have to inform them the things and just mold them according to our rules and regulations. This is also very important thing. So like this, you have to plan the work and the critical analysis of the situations. Everything should be done by the therapist also. And sometimes what happens means, if the doctor may be suggested some treatments like whole body massage, head massage, all those things may be advised for the patient. But whenever you are starting the treatment, that time only you may be coming to know the patient is having some cold or cough or fever kind of symptoms. Maybe in the morning, whenever the doctor was meeting, it may not be revealed, or at the time of treatment you may be understanding that. So there you have to take a decision like that, like this, in the condition inflammation or cold or fever kind of situation. There you are not supposed to use any oil or any oily treatments. So that kind of things are happening means immediately you need to call the physician or inform the physician, or until you are getting any response from the physician, you can stop the treatment also. So that kind of a discriminative power you are having, and you should follow that also. So like this, in each step you may need to take a decision. This is also very important. And something else is, if sometimes I hear from the patients, like whenever the therapists are changing for the treatment of the patient, like sometimes they tell the therapist was doing treatment very very perfectly, they were doing, but I didn't feel that touch of her. I didn't felt that real healing touch. She was doing it, she was doing everything correctly, but I didn't felt that healing touch. So that is very important. Whenever you are having this quality like the anurakta, like interest in the patient's welfare, then whenever your body touching the patient, also able to understand that, like that energy transfer will happen. But if you are doing just mechanically, just sake of doing the treatment, they can understand that, because it is very emotional bonding also will be happening during the treatment time, and they will be so receptive for all these changes. What happens means, whenever the patient is lying down in the treatment table, like as a baby, they will be observing you, and they will be expecting something from you. If you could not able to reach that, they understand that, but they may not complain you, they may not demand anything to you, but they can understand that. So if at the same time, if you are having a very that love and care, and your empathy, everything is coming through your hands, means they can feel that, they just fall with you that time. So which is very important. That kind of feeling should be maintained throughout the treatment. At the same time, as I mentioned before, you should take care of your emotional and physical health also. That is also very important. For that, this is a good like healthy food and meditation or the prayers, everything will help you a lot. So these are the things about the quadrants of healing. And one another thing, like whenever if one quadrant, like either the doctor or the medicine or the therapist or even the yogi, whoever is not ideal, or not having the qualities whatever described, we can manage the situation, and we can give the maximum benefit of the treatment if the other three is working well. The fourth one also should be there, but if we are not getting the proper qualities also, we can manage that uh, by the extra effort from the other three. Sometimes what happens means, the patient is really taking care of them. Like they may they will be observing themselves very keenly. They will bypass you, like the therapist. They will be observing for you how you are doing the things and what is the wrong things are happening, and they will give the feedback to the doctor, and they will play like they can manage by themselves. But it is not the right way. If something like that happens means, then you should manage them more wisely. Your sincere work will correct them from that. And at the same time, if the right medicine is not available on that right time, the physician can take very nice decisions with whatever is available. The combinations can be changed, like that they can manage with the medicines. And as I mentioned before, if the patient is so anxious or not having these qualities, try to give more time for that patient and educate them well, and by understanding their thought and the things, you can more clear about your ideas and the things, and then give description about the treatment, and then they may be more acceptable for the things like that. If we can, however the situation come, we can manage that. So the key point is how our heartful or the sincere attachment or sincere productive mind will help a lot to manage all this situation. So that we should maintain as a physician or as a therapist. That is very important. So these are the things I just want to share with you, and we will chant the shloka few more times. And if you have any queries, and if any part of the session is not understood properly, you can give a mail, you can send a mail, or in the next weekend session we can have discussion on that. And I just I elaborately explained about all these qualities, so you should understand that, and for your exams you should study this shloka as much as possible, and the meaning of that you should be known, and qualities of each pillar, and each qualities, like 4 into 4, that 16 words that you should be known. It will be good to remember in Sanskrit itself. If it's not at all possible, then you study in the English terms, but it will be good if you can able to remember in the Sanskrit terms itself. Even in the exams, I think English terminology also will be enough. Okay, but try to understand the depth of the subject in the practical aspect when you are dealing with the patient care. That time you can be more responsible, or you can take the leadership if you are getting the right depth of this topic. Okay, then you can be the best therapist also. If you are understanding this, what happens means, you know your role, and you know the ideal role of your team. And if it is not ideal, your team is not ideal, you can understand how to manage the situation if you are understanding these things. Okay, so try to focus on that, study well, and let us know what's your feedback and any questions or the things we can discuss. And we can have a small examination, just a small test in the weekend also if necessary. We'll discuss and let you know about that. And some questions if needed I can send you. So that's all about this topic, quadrants of healing. So let us chant the shloka a few more times. That chanting itself help you to remember the terms. Okay. Bishakdravyanyupasthada rogi padachatushayam चिकित्सितस्य निर्दिष्टं प्रत्येकं तच्चतुर्गुणं दक्षस्तीर्थार्थशास्त्रार्थो दृष्टकर्मा शुचिर्भिषक् बहुकल्पं बहुगुणं सम्पन्नं योगिमौषधम् अनुरक्तशुचिर्दक्षा बुद्धिमान् परिचारकः आढ्यो रोगी भिषक्वश्यो ज्ञापकः सत्त्ववानपि भिषक् द्रव्याणि उपस्थादा रोगी पादचतुष्टयं चिकित्सितस्य निर्दिष्टं प्रत्येकं तच्चतुर्गुणं दक्षस्तीर्थार्थशास्त्रार्थो दृष्टकर्मा शुचिर्भिषक् बहुकल्पं बहुगुणं सम्पन्नं योग्यमौषधम् अनुरक्तशुचिर्दक्षो बुद्धिमान् परिचारक आढ्यो रोगी भिषक्वश्यो ज्ञापकः सत्त्ववानपि. Okay, so what are the four quadrants? Bishak, Dravyani, Upasthada or Paricharaka, and Rogi. So Bishak means the physician, Dravya means the formulations or the herbs or whatever it is, the medicines we can say. And Upasthada means the Paricharaka or the therapist, and the patient, Rogi, patient. So each of them are having four qualities. What are the qualities of a Bishak? Daksha, Tirthartha Shastrartha, then what? Drishtakarma, Shuchi. Daksha means like alert, disciplined, and all. Tirthartha Shastrartha means having detailed knowledge about the diseases and treatments which is told in the Shastra, in the text. And Drishtakarma, well experienced, Shuchi, the purity or cleanliness. Then what is next? Dravya, Bahukalpam, Bahugunam, Sampannam, Yogyam, Aushadam. So Bahukalpa, ability to formulate different forms like decoction, powder, whatever it is. And Bahuguna, which is having enormous qualities. And Sampanna, endowed with multiple therapeutic effects. Yogyam means high quality herbs in the formulation. And next is about the therapist. Anurakta, Shujir Daksha, Buddhiman, Paricharaka. So Anurakta means interested. Inner interest can say, and Shuchi, the purity or cleanliness, Daksha, alert, discipline or efficiency or whatever it is, and Buddhiman, well trained or a discriminative power should be there properly. And what is the next? The qualities of a patient. Adhya, Adhyo rogi, Bishakvashya, Nyapaka, Sattvanapi. Adhya means able to go through the necessary therapies. And Vishakvashya, obedient to the healing staff, and Nyabhaga, able to report accurately, and Sattva, having thorough knowledge about their health, disease, and healing, everything. So these are the 4 into 4 gunas of the quadrants of healing. Hope you understood that. And like as I told earlier, you can reach out us any time as with your mail or anything, and we can discuss in the next weekend also. Okay, so thank you very much. Let us wind up with the Shanti mantra. Om Purnamadat Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Thank you very much.